போதையில்லா உலகத்தை காண்போம். வாருங்கள், போதையில்லா சமூகத்தை உருவாக்குவோம்.
Good evening, everyone. This is Manoj, MBBS graduate. I'm doing my pediatrics in MD. So this is my first time in any online platform talking about something more, and I'm very much interested in this topic as of now. When someone called me regarding this, I was like, why me? And then this is more like a social awareness which needs to be shown to everyone. So thank you for UH Media for anti-drug awareness campaign taking me as a speaker. And I'm sorry, mostly நான் அப்பப்போ இங்கிலீஷில் பேசிகிட்டு இருப்பேன். And I'm not that good in Tamil, but ஆனால் நான் மோஸ்ட்லி தமிழில் பேசி பார்க்குறேன். And so thank you. So let's start this presentation or the topic. So be drug free. So what has happened in India is previously the drug abuse in சொல்லுவீங்களா அது வந்துட்டு it's more than the normal range. எப்படி சொல்லி பார்த்தீங்கன்னா the general populationலேயே பார்த்தீங்கன்னா வந்திருக்கு. And Indian government has come up with this Juvenile Justice Law Act 2015 to bring in to reduce the drug intake. So இப்போ recent times the 5 most common drugs என்னன்னு பார்த்தீங்கன்னா alcohol, ganja, nicotine, cigarettes, proxipine, அப்புறம் opium அதெல்லாம். ஸோ இப்போ என்ன இருக்குன்னா ஏன் நாலேஜ் படி இந்த ரீசெண்ட் ஸ்டடீஸில் வந்துட்டு என்ன இருக்குது, there is more of the Indian youngsters are more involved. So our NGO survey nearly 63.6% of patients are coming in treatment with introduce of drug below 15 years. So as a pediatrician, 63% in a pediatric age group is not although easy, because when I was a youngster we had a better social life. We never got access to the drugs which are available now. As I said, nearly more than 13.1% are involved in drug abuse in India are below 20 years. So உங்களுக்கு அந்த ரேஷியோ புரியுதுங்களா? ஸோ 15 years இருக்கும்போது 63 and 20 years இருக்கும்போது 13. It's nearly tells you that there is more emerging trend of abusers compared to the one who are actually doing it. So now going to the presentation, and this is completely for social awareness. I might be wrong, flosses will be there, so please take a minute. So the definition of a drug. So what's a drug? A drug is a substance other than food which changes the way of a person thinks, feels and acts. So say taking cigarettes will be a stimulant. அதே மாதிரி ஒரு ஆல்கோஹால் எடுத்துகிட்டு it's a depressant which will reduce your brain functions. And அதே மாதிரி cigarettes எடுத்துக்கிட்டிங்கன்னா it will stimulate your brain, fasten your thinking, which has become a new thing here. So other than that, நீங்கள் பார்த்தீங்கன்னா the legal drugs which is approved in India, alcohol 19 years மேலே எடுத்துக்கலாம், tobacco which is cigarettes which can be taken more than 19 years, marijuana not in all states but சில ஸ்டேட்டில் இந்தியாவில் it's still permitted, and prescription drugs are completely different. இது வந்துட்டு நம்ம இந்த ஏஜ் குரூப்புக்கு யூஸ் ஆகாது. அதுக்கப்புறம் இல்லீகல் ட்ரக்ஸ், illicit ட்ரக்ஸ்ன்னு சொல்லுவோம், அது கொக்கேன், எக்டசி, அப்புறம் ஹெரோயின் அந்த மாதிரி. ஸோ ஐம் நாட் ஷுர் இது ரோட் சைடில் கிடைக்குமான்ட்டு, பட் as much just the classification. ஏன்னா நம்ம இந்தியன் கவர்மெண்ட்டே அப்ரூவ் பண்ணுற ட்ரக்ஸ் வந்துட்டு லீகல் ட்ரக்ஸ், அண்ட் the other ones are illegal, and now I feel it's more available in the local societies, the streets. So addiction we classify in 4 C's. Craving, loss of control of amount, frequency of use, compulsion to use, use despite consequences. And tobacco is most often the cigarettes, and the recent guidelines, the recent it's more than 19 years. So and the effects of tobacco, obviously yellow teeth, bad breath, cough, decreased exercise tolerance, lung damage, அதுக்கப்புறமா heart attack, stroke and addictions வரும். And electronic cigarettes and vapes, இப்போ ரீசெண்டாக the Indian government has banned it, but ஆனாலும் it is easily accessible for youngsters. And so like battery operated one, the cartridges are more contain of nicotine, vapors which mostly affect the lungs. So and alcohol, as I said, a depressant, brain stimulation குறைக்கும், and moreover affects your brain and your spinal cord, heart rate, it increases, and breathing also. So what alcohol does to the body, generalized is enters your bloodstream. So blood enter it causes blurred vision, cannot react as quickly, அதுக்கப்புறமா increased risk of taking, and slurred speech. Alcohol or consumption and percentage ratios, which is nearly in a standardized alcohol contents சொல்ல வரேன். Like 340 ml எடுத்தீங்கன்னா beer 5%, 140 ml wine, 45 ml of any kind of liquor. Alcohol poisoning is a kind of something which is new. Mostly we don't see alcohol poisoning frequently in this thing, in our routine. As a doctor, if you sit in a casualty or emergency room, அப்போ உங்களுக்கு தெரிய வரும் alcohol poisoning என்னன்ட்டு. There are chances of respiratory arrest, aspirate ஆகி போக chances இருக்கு. So cold, clampy, pale or bluish skin, slow breathing, cold vomiting, confusion, shakiness, unconsciousness and passed out. So this is the butcher's menu and solo. So this is like a normal way to resuscitate a patient. So rise the person arm closest to you above your head, gently roll towards you, and using the shoulder, guard the head and roll down. So tuck the nearest hand under the cheek and drop the top and knee forward to stabilize. And stay with the person and monitor calmly. So if someone passes out, knowledge படி பார்த்தீங்கன்னு வச்சுக்கோங்க, check for the pulses. So at the same time, இப்போ நீங்கள் drug abuse அப்படின்னு சொன்னால் கூட, you need to know if a friend who's been taken too much alcohol, you should know the basic maneuvers. நான் எப்படி சொல்கிறேன்னா, someone has created a crime, which doesn't mean he has always to be the victim. You can also intervene and then you can bring him out. So a person வந்துட்டு full and full alcohol dependent இருந்துட்டு, you can socialize and make new plans and come out, but at the same time you should know how to help a person who is fully drunk. So one of that is butcher's menu. Why am I putting this in this video is that although there are new the anti-drug campaign இருந்தால் கூட, you need to know that every life matters, right? இப்போ நீங்கள் வந்துட்டு ஒருத்தர் ஆல்கஹாலிக்னு சொல்லி தள்ளி வச்சிங்கன்னா தப்பு இல்லை. ஸோ a person by soul is different from the behavior he has, because you can't just judge a person with his behavior. You can make him a good person with நீங்கள் பேசி அவங்கள மாற்றலாம் இல்லை. And cannabis, marijuana, ganja comes from, cannabis is like a plant, okay? It's like a cannabis sativa plant, and it contains THC. So it can be laced with other substances also. So what does it do to your body? Cannabis, ganja, it increases your appetite. Like உங்களுக்கு அதிகமாக பசி இருக்கும், கோஆர்டினேஷன் கம்மியாக இருக்கும், கான்சன்ட்ரேஷனை குறைச்சிடும், அதிகமாக இதில் இருப்பீங்க, ஹலுசினேட் பண்ணுவீங்க, மெமரி லாஸ் இருக்கும், lung disease வர chances அதிகமாக இருக்கும், and addiction. So non-medical use prescription drugs is completely to doctors. We don't prescribe, but they illegally take it from the pharmacies which are available locally. Example one to painkillers, ADHD medications, sleeping pills. These also are kind of drug abuse. இப்போ நீங்கள் ஆல்கஹால் டொபாக்கோன்னு மட்டும் பார்த்தீங்கன்னா இல்லை, even painkillers is kind of an addiction. So consequence of drugs and alcohol, decreased athletic performance in general. அதுக்கப்புறம் as a youngster your school performance will be less because நீங்கள் அதில் டைம் அதிகமாக ஸ்பெண்ட் பண்ணுறதுக்கு your brain will take the time to regenerate the activity. So if one thing is being stimulated or depressed, to come back to its normal threshold, it takes time. So as a doctor, if I have to say, it should be either in a minimal use or should be advised by a clinician, or need to know your own limits. There are chances of sexual assault, dating violence, vehicle crashes, decreases decision making and ability. So reason why some young people use drugs, generalized an idea. So the most common thing as this is like we have attained 19, so opportunities available are, so if you take your own decisions, that's the symbol of being maturity. That's one of the reason why everyone gets into this. Okay, well, to have fun, to rebel authority, increase in confidence, so to maintain standards and the cope body image, like cool, fit in friends, and the madriyana idu. And one of the reason is mental health issues also. For example, if you're mentally disturbed by an accident or a breakup or something, the easiest stimulant or depressant which is nearby available in your local hands in poning nada this hands up. So in order to that, you can either socialize with some other people. See, if one person is not with you, it doesn't mean the whole life is not going to go on, no. And curiosity, one of the major things. So mental health and substance abuse. So problematic substance use and mental illness can be closely connected. So mental illness contribute to problematic substance use and staying safe. So how to be safe? Using good friends, refusal skills. Say no. If someone is telling you or giving you something, just say no, because it can be said no. Like, there is something where there is curiosity if this can be done and all, but you guys have options to say no. Safety agreement, texting a code word, knowing where to go for help. Like if you have a friend, a buddy, it's better to explain what is. And from this, I complete my presentation. At the same time, as I said, the recent ones, like nearly 2 crore children a year, nearly 55,000 children a day are drawn into tobacco addiction. Comparatively in US, பார்த்தீங்கன்னா ஒரு 3,000 a day தான். ஸோ நம்ம although population wise அதிகமாக இருந்தாலும் addiction wise we're surpassing the western countries. Although there are actions taken by the Indian government, Narcotic Drugs Psychotropic Substance Act 1985 and the மாதிரி acts இருந்தா கூட we are still in a place where we're not connecting people. So what I feel in this should be that we should create awareness and bring and stop substance abuse. Thank you. And I'm so sorry, நான் அவ்வளோவா தமிழில் பேசல, ஏன்னா எனக்கு அவ்வளோவா தமிழ் பேச வராது. I tried my level best and thank you very much.